There are so many incredibly contradictory statements, and then they just have to take painkillers because they have no other choice. Training shapes the body. That makes my stomach turn because that's just nonsense. Never get cortisone, that is, an anti-inflammatory drug, injected. Do the pains that are felt have nothing to do with the condition or the structure? And that's why you always have to keep the entire range of movement over the 24 hours in mind, because that's where most pains come from. If you only do the sport and not the rest, you'll definitely get pain. And it's been like that for 40 years. And it drives me crazy because they just don't learn.
Doing sports is so important, especially from the age of 45 or 50, because the muscle breaks down if you don't move it. And that's why there's already a disease called sarcopenia, loss of flesh, literally translated. And I can only advise against that because having little muscle means you're heading straight into illness. And I don't think any of us want that. And that's why you'll learn why exercise is good and what you can do to make exercise possible without pain, so you can simply get really fit again. Exercise or no exercise, did you know that both can cause pain? Roland, there are these sayings like exercise is murder. It's always attributed to Churchill, but that's not true at all. It didn't come from him. He may not have done a lot of exercise, but it's not like he came up with that saying. So there's that one saying, and the other saying is, he who rests, rusts. And between these two sayings, there are millions of people in pain. And they're asking themselves, so should I exercise now? Or maybe should I not exercise after all?
Really great topic because it's a complete mess.
Yeah, I think it's confusing too.
A complete mess because people exercise, get pain, think, oh shit, I get pain from exercising, and then they stop. It's not good for you, and you know that if you're informed. Others don't exercise, lie on the couch, and also get pain. Still others do something completely different and also get pain. No one gets it, and then you go to the doctor and ask, what should I do now? And that's not necessarily a topic in medical school. That means the doctors then say, to the best of their knowledge and belief, what they themselves would say.
Maybe also their experience.
Yes, exactly. And if they've had the experience that when they go jogging, their knee hurts, then they'll probably say it's better not to jog anymore.
Yes, exactly.
And so on. So what I mean is there are an incredible number of contradictory statements, but we'll clear all of that up today. Completely, down to the smallest detail. You'll be able to understand when exercise causes pain, when exercise doesn't cause pain, when lying on the couch causes pain, and when lying on the couch doesn't cause pain. Just to mention the two extremes right now, yeah.
Yes, but there really are countless people who say when I move, I get back pain or knee pain. Or even, yes, in the worst case, I have to take painkillers. And that's not good for me either. It's not good for the body. And if it's really bad,
but even much worse,
then I have to have surgery. That's one side of it.
Exactly, yes. But the next thing is many people who are in pain then go to the doctor. And the doctor diagnoses osteoarthritis of the first, second, third, or in the worst case, fourth degree. And then there's always this saying that I can't stand hearing anymore because it's just ignorance, where they say, well, you already have second degree osteoarthritis and you should take it easy because otherwise it will just get worse. And basically they keep telling me that your tread is worn out. The tread? So told by patients who were informed accordingly, your tire tread is worn out, now you need a new tire. And that's the artificial joint. That makes my stomach turn because that's just nonsense.
Do you know what I read in a comment on our podcast? Someone wrote that a favorite diagnosis of doctors when they can't explain pain is actually the term osteoarthritis or the diagnosis of osteoarthritis.
Yes, of course.
Because it's so easy. Nobody really knows.
But wait a minute. Yes. So we've known this for 30 years, but maybe some people out there know it. But it's just not put into practice because the next thing is, even if there are doctors or other therapists who know the connections to some extent, they just don't have the solution for it. And that's why they say, which I can understand, before something goes wrong, you'd better stop your sports. You'd better take it easy. Yeah, who knows what might happen if you keep going like this, which you're right, yeah, because when a patient has developed osteoarthritis in their movement pattern, we'll get to that in a moment, if they keep going like that, it just gets worse and worse. So apparently continuing is a mistake and resting is also a mistake.
Continuing the same way is a mistake.
Repeating the same actions is a mistake, just as resting is. But shall we get started?
I think so.
You have to say it now.
I think we'll just get started right away. But I think, and that's why I also think you should definitely listen to this podcast until the end. It's the lack of knowledge, meaning not knowing enough about the connections between pain, exercise, no exercise, and pain. And that's why it's so important.
I don't think you even need to
listen now, because sports are not only essential, in my opinion, not only in your opinion, but according to all of science, they're vital for survival.
Absolutely. And above all, the older we get, the more exercise we need, because there's muscle loss and then it hurts more and so on and so forth. And we really need movement. And therefore, being pain-free is a prerequisite for doing sports. So how do these pains even develop? What really shocked me a few years ago, because I didn't know this for many years, is that there are studies reporting that a lot of athletes, about 80% of those who compete, can only finish their competitions, no matter what kind, by using painkillers, because otherwise they would have to quit since the pain becomes too intense during the competition. That completely blew me away.
Yes, it surprised me too, because I just didn't think that people, especially those who are so conscious of their bodies, would treat themselves this way, that before they can even be physically active and show their performance, they actually have to take suppressive painkillers first so that the pain doesn't come up. Somehow
Yeah, what else are they supposed to do?
Yeah, just already.
Are you passionate about your sport?
Consider it, or what's behind it? Oh my goodness.
Petra, if you haven't read any of our books and if you don't hear this somewhere else, then you're trapped. Because then you want to do sports. Sports are good because you feel like playing tennis because it's fun, yeah? Or, as an older person, I really should get moving. I should go for a walk. And then you simply have to take painkillers because otherwise you have no choice. But that's what we want to change, since we already can.
But would you say that we...
Wait a minute. Yes, I already want to say that everything will be resolved. By the end of this podcast, you'll know why you don't need to take painkillers. In most cases...
But the way you described it, you basically just said that exercise always causes pain.
Yeah, sure. Look, it goes that far. In medicine, you have what's called occupational diseases, meaning people who have certain jobs develop specific illnesses.
Exactly, Baker's asthma, for example.
Yeah, whatever. Yes, there is a certain connection between illnesses and professions, and there's also a connection between sports and pain. Yes, the tennis elbow, the famous one. Everyone knows that someone who doesn't play tennis can also get tennis elbow, but whatever. Tennis elbow seems to occur especially frequently among tennis players, otherwise it wouldn't have that name. There's golfer's elbow, then there's jogger's shin, then there's runner's knee. And these are all clear indications that something happens in these sports. And there's a lot more happening than there are names for. And maybe I'll start with that if it fits into your plan, Petra. I'll explain why sports basically have to lead to pain, more or less.
I find that super interesting because honestly it confuses me a little bit.
But I'll also explain right after that why being a couch potato just existing also has to lead to pain. Still, there are people who exercise and don't get pain, and there are people who just lie around and don't get pain either. And that's exactly what we want to clarify, all this confusion. We're really going to clear it up. So I also think so. I'm really looking forward to it because it's going to be like scales falling from your eyes.
But again, you're really saying that exercise, without any further explanation, must always lead to pain.
Or at least closer to pain if certain things don't happen. But we'll analyze those in detail.
Okay, then go ahead.
How do most pains actually develop? I have to start with that. How do most pains develop? In our experience, almost 40 years after all.
It's this year now since we have a new year.
Yes, it will be 40 years. So, What is now crystal clear to us, and there are also many studies that go in this direction and indirectly support this view, pain mainly arises because there is something wrong with our movement patterns. Now, we first need to explain what is a movement pattern.
That's exactly what I was about to say.
It's simple. You get up in the morning, brush your teeth, maybe stand on the key retter while doing it, or maybe not. Then you go to the office, take the streetcar, sit down, sit in the office again, go about your day, and at night you lie on your side or on your back, or however you like. All of that together is your movement profile. Basically just a video recording of your movement over 24 hours. And most people have movement profiles that aren't exactly the same every day, but are pretty similar. Because they have their routines. Some do certain sports, others don't. Some spend the whole day sitting around because of their job, and some don't. And that's how the profile is created. So that's one thing. The other thing is, how could we humans actually move? And basically that's really, really simple, because you just have to look at the skeleton and then you can already roughly see how you should be able to move. There are joints, like the knee joint, for example, which can really only extend and bend. So a one-dimensional movement along one axis, so to speak.
Isn't that called a hinge?
No, that's not a pure hinge joint. A finger joint is more of a hinge joint.
Okay.
So the knee mostly works like a hinge joint, but it's actually also capable of rotation, at least when it's bent.
Yes, that's right.
That's why it's not a pure hinge joint. Yes, then there's the ball and socket joint like the hip, which allows movement in all directions. Then there's the elbow joint, which consists of two joints. It can rotate and can bend and straighten. Yes, so the whole body consists of about 100 joints, which can be moved in a certain way. So all these joints are moved because we have muscles. They are the engines of movement. The muscles are...
I would like to repeat it again. Muscles are the engines of movement.
Yes, of course.
Beautiful.
Unless you fall down. Then gravity is also a driving force of movement.
Okay, all right.
But your own body movement is powered by muscles, by nothing else. Yes? At least directly, indirectly also by the spring forces of fascia and things like that. But the actual engines that initiate movement are the muscles, and a joint is always built the same way. It has muscles that pull in one direction, or it's surrounded by muscles that pull in one direction and other muscles that pull in the opposite direction. If they are simple joints, if they are more complex, then there is something next to it that also goes in one direction and the other. That's how joints are structured. That's how joints move. And
that means we always have movement in one direction.
And one in the opposite direction?
Exactly, one in the opposite direction.
Of course, you can screw in and unscrew.
Exactly.
You can bend and stretch. You can go to the side and to the other side and so on and so forth. Right? That's built into the body, and the muscles, the fascia, they're attached to it. And these movements are built in because we are biologically designed for it. That's how we are made. Yes? Because either you think, now the God model, God created humans, or from an evolutionary biology perspective, evolution created humans. It doesn't matter which one. The joints we have them to use them. There aren't any joints built in where you could say you have to use this joint fully, you don't need to use that joint, and you can use this one moderately. That would be nonsense, because if a joint wasn't meant to be used, it wouldn't be there at all. Yes, that's a compelling logic within this whole system of muscles, fascia, bones, and joints and so on that's built in by necessity. And now we just have to make one thing clear. I have to explain it now, not show it, because some people aren't watching this podcast. Now imagine you have an arm with an elbow, and you can stretch out your arm. I can still do it anyway for those watching the video, but I'll explain it as I go. You can stretch out your arm, and then you can bend your arm. And when the arm is stretched, the muscles on the outside of the arm contract, and on the inside, they have to give way. It's always this interaction. On one side, the muscles pull and get shorter, while on the other side, the muscle being pulled has to give way and gets longer. And with the opposite movement, it's the other way around. And every joint works like this, from the tiniest finger joints to the hip joints and the largest joints. So, and the moment this movement, full extension, full flexion, is done every now and then during the week. Then the muscles are adjusted to it and the fascia are adjusted to it. The fascia are passive, flexible networks that are inseparably intertwined with the muscles, for example, surrounding the muscle with the fascial sheath. And of course, this fascial sheath has to follow the muscle movement. If the muscle gets longer, the fascia gets longer. If the muscle doesn't get longer, the fascia stays short. And if it keeps getting stretched out and then stretched out again in the other direction, that means if this one joint we're looking at is always moved through its full range, and if that were the case for all the joints in the body, people would have 99.5% less pain.
Why?
Why not?
No, I'm just asking now. So what you're trying to say is
I'll explain that in a moment, but tell me.
That at the moment this movement is done completely, the joint is always guided exactly the way it needs to be to stay healthy.
That's what I wanted to say.
Okay.
So first of all, just a statement. The statement is move all joints through their full range of motion. That's called full range of motion, then people wouldn't have any pain. That's my statement. Maybe some surprised faces among the listeners, then most pains wouldn't exist. How did I get 95%? 40 years of experience. Yes. So now we have to look at what happens if I don't use a joint through its full range of motion. You might say, well, with a car, I just don't use that gear and the car still keeps going. But the body is different from a car because the body is made of renewable resources, so to speak. In other words, it's made of cells.
A living and open system, unlike a car.
Yes, but that's theory. In practice, everything that changes in some way, any kind of stimulus for the muscles, for the fascia, leads to the muscles and fascia developing differently. That's called training, and it's undisputed that this term exists. Training shapes the body, and not training also shapes the body. Not stretching the muscles to their maximum length through the full range of motion of the joint leads to the control programs for this muscle regressing. Because certain angles of movement are no longer used at all, certain length states of the muscle are no longer stored in the program that way. At the same time, the fascia adapts. This network is constantly changing, even from second to second. The way we move, our fascia is a reflection of that. First, there's a genetic background, but then, far from genetics, everything develops according to how we move. Take two identical twins, they have the same system as newborns. But if one sits all his life and the other works as a landscaper all his life, then they end up with completely different musculoskeletal systems, even completely different bones, because the bones also shape themselves according to the forces that are applied. In any case, there's one thing you can remember. Muscles and fascia that aren't stretched for a long time eventually don't want to be stretched anymore because they're not used to it. Let's keep it simple. We've explained it in more detail elsewhere, but this needs to be clear for now. If I no longer take a certain angle, then what has to give for that angle is no longer used to giving in and will start to resist it. And that's where we get to a really important point, because if my elbow extension now, if the elbow is surrounded by flexor muscles on the inside that no longer want to give in, then the extending muscles have to work against the flexors, because the flexors don't want to give in during extension. And that creates force in the joint, and that causes osteoarthritis. In the knee joint, it causes meniscus tears or meniscus detachments. In the spine, this causes disc deformations because the discs are compressed too much, sometimes even bulging, or the wall tears if the force becomes too great.
You said that creates force in the joint. Do you mean that the pressure inside the joint becomes so great?
You can imagine it like this. Imagine there's a pulley hanging from the ceiling. A pulley, so a frame with a round wheel inside, and a rope runs over it, with both ends of the rope hanging down. And you can imagine good joint function like this. Now you pull the rope on the right hand goes down and the left hand goes up and gives way. And the other way around, the left hand pulls down and the right hand goes up and gives way. If you now hang a spring scale on top of this pulley, the spring scale measures the force with which the pulley is being pulled down. Then, if you are already giving way with the other hand, you will hardly notice any movement. But if you now pull down with your right hand and don't want to give way with your left hand, then the spring scale will be pulled down. Because then the pulley has to transmit the force. And exactly the same thing happens in the joint. Another example, you know those seesaws on the playground, right?
Mm-hmm, swings.
No, the swings hang from a rope.
Oh, I see.
That's the seesaw.
Yeah, okay.
The seesaw is the rigid object positioned over an axis or frame.
Yeah, you're right.
Right? And now someone sits on one side and someone else sits on the other side. If they're both floating now because they're the same weight, then basically one of them has to push off with his leg, then the other one can go down. And that's how you rock back and forth. But if now one of them sits on it and the other one, adults do that sometimes, yeah? There's a child sitting on the swing, and of course it doesn't go up because the counterforce is missing. So the adult goes to the other side, takes their hand, and pushes it down, so that the child goes up, and if the child is light, then they only have to push down a little. If the child is heavy, they have to push more. If a very heavy person is sitting there, you can't push it down at all. And which mechanism, which mechanical part transfers this pushing force? The suspension of the seesaw in the middle, you can picture it like a joint. And at the moment when the muscle on the flexor side of the elbow doesn't relax properly, but I still want to extend my arm and really pull on the extensor, then there is a counterforce in the flexor muscles, which causes the elbow joint to be much more stressed than if the muscles would just relax.
You mentioned earlier that there is tennis elbow and golfer's elbow.
And even already.
Yes, but we're talking about the arm right now. That's why I wanted to ask, why does this happen in tennis? Could you maybe explain that?
Because this is going to get complicated anatomically, especially without a drawing. Because with certain strokes for tennis players, tennis affects the outside. Forces are transferred there, which in this whole system, it's a tension bracing. Let's put it that way. The detail. There's a tension bracing that goes from the outer side of the elbow over the wrist to the inner side of the elbow. On the outside are the extensors, and on the inside are the flexors. And in tennis, depending on which racket you use and how you play, in terms of technique, there are increasingly greater forces in this tension bracing. And in tennis, at some point, the forces become so great that the extensors are tensed so strongly that the tendon, which has grown into the bone at the outer elbow, is constantly being pulled on. And that causes a small inflammation and micro tears and that leads to this annoying tennis elbow, which supposedly is hard to get rid of. Our technique lets you eliminate it quickly and effectively. Now take golf, same example. Golf affects the inside of the elbow. Obviously, when playing golf with a certain type of swing and certain physical conditions, the forces act in such a way that the flexor muscles, which are attached to the inside of the elbow, generate too much tension, causing microtears in the tendon, and then it becomes inflamed. And yes, in the worst case, you play tennis and golf and have problems on both the inside and outside. That was just a little joke. Yeah, I can only joke like that because I keep reading about it on the internet. Tennis elbow isn't really curable. You can somehow manage it or something, but the cause is unknown. So whoever knows what we're explaining today knows exactly how something like this develops. Period. Yeah. And let's just take jogger's shin as an example. Jogger's shin, that's this pain at the front of the shin. And that's connected to the fact that people suddenly catch their toes on the ground while jogging. That's the first sign that something's wrong. They can't lift their foot. Why can't they lift their foot? Because their calf muscles are undertrained, too tense, and that pulls the foot down. And when the front muscles can't lift the foot anymore because the calf at the back is pulling the foot down so much, yes, that's also a kind of tension band from the shin in the front over the ankle and then back into the Achilles tendon at the back. Yes, exactly. Just like the tension band in the arm. And there too, if the runner always has to hold up his foot in a cramped way, against this pulling force of the calf muscles, at some point the lifting muscles in the front of the shin, they just give out. There are micro tears, the muscle cramps and hurts, then there are the small tears. And this jogger's shin, it can get so bad that there are really severe inflammations where you think, oh, you need cortisol for that. It's really badly inflamed. That's nonsense. The inflammation there is a reaction, it's a repair response to micro tears, similar to what happens with the Achilles tendon. Some people get jogger's shin, others have their Achilles tendon tear or it becomes thick and swollen. Why? Because the tensile forces are too great. There are micro tears and they need to be repaired, and that's what inflammation is for. Inflammation repairs what is damaged. So please, whoever is listening, never let anyone inject cortisol, meaning an anti-inflammatory drug, because that's simply a mistake, what's being done there. That's not a bad inflammation that needs to be eliminated or injected away. That's a repair process that's taking place. And the moment the excessive tension, this pulling from the shin bone into the calf, is normalized, it heals quickly on its own. And a chronic jogger's shin and a chronic Achilles tendon irritation is nothing more than an unknowingly mistreated or untreated situation, which then doesn't stop on its own. Because if I don't remove the cause, the excessive tension in the muscles and fascia, if I don't eliminate this cause, it will never heal. And then I can inject as much cortisone as I want, the body still has too much tension, and it won't be a permanent solution. Except for moon face. Yes, sorry, but if the dosage is too high, then at some point you get those strange faces.
God, but that's really harsh what you're saying.
I'm just straightforward and simple.
But okay. But there are also illnesses where people actually have to take cortisone to keep living. And then...
But not for an Achilles tendon irritation.
No, not there. Yes, that's why.
And please don't forget, there are doctors who have explained to me, Roland, what we know, for example, is that cortisone makes the Achilles tendon so soft that it tears much more easily. Yeah, so it's no joke. That needs to be said clearly, so that you as a listener at least get an idea and can then decide for yourself what you want to do. Yeah, but back to the topic, we were talking about why the pain occurs, and it happens because the forces become too great, and these increasing forces have two effects. The first effect...
In the joint?
In the joint.
In which joint?
Pick one.
Ankle.
Knee joint, ankle joint.
Ankle joint in this case now. Yes, ankle joint in jogger's shin.
Yes, but no.
No?
Namely not, because also, let's take the example from earlier again, flexor, extensor in the arm. Yes. Tennis elbow, golfer's elbow, I'm just making you aware of the whole range of possibilities.
Mm-hmm.
So it starts with tennis elbow on the outside of the elbow, then cramping pain in the extensors, then wrist pain, wrist osteoarthritis, tendinitis, carpal tunnel syndrome. Then up the other side again, cramped flexors, and that eventually ends up on the inside of the elbow in what's called golfer's elbow. Yeah. That means what actually occurs there, whether it's pain in the elbow, pain in the wrist, or mechanical defects, that depends on what the training ultimately looks like, where the focus is, and also on genetics. How is this body built? But it's all along these excessive forces. And what develops there can be divided into two groups. Group number one is the pain, and group number two is what gets damaged. I forgot to mention ganglion cysts. That's also a reaction in the wrist. All of this is to somehow cope with these forces, because the body says the guy up there in the brain doesn't understand what's going on. Now I have to do something to somehow save myself here. And why do I distinguish between these two groups? I distinguish between these two groups because, and now it's going to be tough for many, the inflamed Achilles tendon or the pain from tennis elbow or wrist pain, in other words, all these pains usually have nothing to do with the actual damage that's happening there. So I can have wrist osteoarthritis without my wrist hurting, or I can have the worst pain in my wrist without there being any osteoarthritis. We know from many, many studies that there is no causal connection between them, but that's not how it's interpreted. Yes, it's just not put into practice that way. But I can tell you very clearly now, as listeners from our 40 years of experience, in the vast majority of cases, the pain that is felt has nothing to do with the condition of the structure. That means, for example, with Achilles tendonitis, you can have it, the Achilles tendon can be extremely thick. You relax the muscles and the pain is gone, and the inflammation is exactly the same 5 minutes later as it was before. Or with tennis elbow, by reducing the tension, you can suddenly make it not hurt at all. But now that depends, this is a small exception, on how intense this inflammation repair in the elbow is, because sometimes it takes 1 or 2 weeks until this inflammatory reaction has healed enough. But that's an exception. Many other inflammations you can make pain-free immediately. If you ask me now, why is it like that with tennis elbow? Then my answer is because obviously with tennis elbow, the whole thing is so localized. It's usually just 1 or 2 millimeters that go out of control there. That overall relaxation hasn't really taken hold in this small area yet. But it doesn't matter, because those are exceptions. Basically, it's important to keep in mind, and it doesn't matter whether the pain has anything to do with the structural damage or not. The cause is the excessive tension in the fascia and the muscles. I think that's been covered for now. Earlier, I claimed that every sport... Oh, wait, no. There's still an intermediate step missing, so the intermediate step is now. We said that if the angles of all the joints throughout the body are used from time to time, that means that the muscles and fascia are repeatedly stretched to their full length. They can't really adapt to shortening or increased tension. That means a free life in the forest, climbing trees or whatever, can allow you to live completely pain-free, but not in our society today. There, the movement profile over 24 hours is usually so limited that it automatically leads to certain pains and, of course, the damage that comes with it. Not necessarily, but it can also occur that all of this develops. So what actually happens during sports? Sports are characterized by the fact that we prefer certain movements. Because if you want to be good at sports, and the more you specialize in sports, professional athletes, elite athletes, they all have a very, very specific range of movements. And the more specific a range of movements becomes, the more is excluded from the movement profile, because there are only 24 hours in a day. And if I spend a certain amount of those 24 hours sleeping, a certain amount sitting, and always use my sports training for my free movement, then I'm always doing those important athletic movements. Top athletes are so good because they train the movement patterns of their sport especially often. There's no way around that. And what does that lead to? That certain angles are used less, and others much more compared to those that are used less. That has to lead to pain. And jogger's shin, runner's knee, everything we've talked about, and many, many other pains are proof that the body reacts exactly like that. And that's why I said sports have to lead to pain. I can say right away, no sport has to lead to pain like that. And I can also say desk jockeys. Being a desk jockey has to lead to pain, but at the same time, it doesn't have to lead to pain. And now please pay close attention, because now everything gets mixed up, all the things that are out there in the world. If a professional athlete who trains extremely hard in certain areas of their sport to be good, happens to have a certain sleeping position, happens to go dancing, or happens to do something to balance out the one-sidedness of their sport, they won't get any pain or injury. If the couch potato lies around all day, they get shortened from top to bottom. No idea, maybe once a week they do something like go to the fridge and the fridge is really low and they have to bend down. And then he has to reach for a high cupboard because he still wants to get his sweets, and then he has to reach up. If something happens there that balances it out, he won't get certain pains. If the desk worker, I'll create a scenario now. So there's a master painter. A master painter, he paints for half a day, and for the other half, he has to do office work while his journeymen do the work. So now he sits all day and shortens in the front, but for half a day, because he enjoys it, he also paints. He paints ceilings, has his long pole with the brush on it, and paints the ceiling white. What does he do? He stretches back and completely counteracts the sitting. A master painter who just sits at his desk gets back pain, but one who paints, especially ceilings, doesn't. Do you get it? And that's why you always have to keep the entire range of movement over the 24 hours in mind, not just individual small movements. So if things go wrong for the athlete, he gets his sport-specific pains and his sport-specific injuries. If things happen to go well and the emphasis is on happen to, then he doesn't get them. And it's exactly the same with all other professions, all other hobby groups, all other sports groups and sports. If you only do the sport and nothing else, you'll definitely end up with pain. If you happen to do something else in your everyday life, then it might accidentally balance things out. And that's the solution to this mystery. Why does sports sometimes cause pain and sometimes it doesn't? Why do some people sit and have no problems at all, while others sit much less and still have problems? All of this is practically determined by the rest of your daily life, the rest of your movement patterns that aren't being observed. So what actually causes the pain is solved by that. I know cases, for example, patients who were doing great hip-wise. We had corrected something there. No idea. I just know there was a case where someone switched from a manual transmission to an automatic and they really started having problems. And I then asked, did you change anything? And then he thought about it, different sport, different strength training, what else is he doing differently? He didn't even think about the car. People just don't realize that something as silly as switching from a manual to an automatic in a car can cause hip pain. Thousands of people do that and have no problems. But in this case, the range of movement was such that this change of car triggered it. And once you know that, you can finally relax.
Which would be, I listened to you very carefully and I know all about it too. For me, there's one solution, but of course you'll have to explain it in detail again. By making compensating movements.
We're not there yet.
Or really tries to move the whole body.
Good topic, because of course that's an option. But over the years, I used to think, okay, they have to swim, they have to climb, they have to run, and ideally they should also play a ball sport, soccer, tennis, or something else. And that's when I realized nobody has the time for that. You'd be doing sports from 7 in the morning until 9 at night just to balance all of that out. And then it became clearer and clearer. Impossible. And that was the reason. We came from the perspective where we realized that certain exercises help. And then, with the development of this theory, all the experience led us more and more to realize that it is completely exaggerated. Let's rather do it this way, as we say, because otherwise they would all be overstrained, right? We simply say, look, you want to be a professional soccer player? Do it. We'll explain what to do so you never feel pain playing soccer. You want to run, marathons and whatever else, do that one-sided endlessly. We'll tell you exactly what you need to do so that you never have knee problems. You want to play tennis without getting tennis elbow? We'll tell you exactly what you need to do. Keep doing what you want to do. And since we're talking about sports right now, yes, do the sport the way you want. Your body will show you anyway where the irregularities are, where your movement pattern has gaps that lead to pain. Because that's the next question now. I mean, that's the theory. But how does the world-class soccer player even know? How does he know what to do to address his specific pain? Many have back pain, knee pain, hip pain.
Yes, one more thing, that's a diagnosis that is often forgotten. this pubic bone inflammation.
Yes, that too.
That's also very typical for soccer players.
It can get much worse. A famous soccer player nearly ended his career because of this, though I can't name him. Still, we became world champions thanks to him. Now you can think a little about who it might have been. In any case, in this area of high-performance sports, there is a ban on treating the pubic bone in cases of pubic bone inflammation. Yes, simply because obviously the knowledge isn't there that you can easily remedy pubic bone inflammation by relieving this tension. If you can't treat the pubic bone, it becomes hard. You're supposed to do the exercises, but you don't because it hurts. So you really have to know what you're doing in order to apply it. Yes, that's what it means. That's possible in cases where really all the world-class doctors and everyone else have shown that they couldn't figure out what would be best to do. But if you, as a listener, have followed and understood this, then you could have helped this soccer player too. Because what is inflamed at the pubic bone, where the tendon transitions into the pubic bone, is the adductor muscle that's pulling too hard. Watching the young guys train, you know what's happening, and there's nothing wrong with this AB workout. But it needs to be balanced. Yeah, all this strengthening that's being done. Let's briefly talk about all these things in sports. Whenever a knee is unstable, when the hip doesn't work, when there's pain, it's always strengthened. And that's been the case for 40 years. And it drives me crazy because they just don't learn, in my opinion. That might sound a bit arrogant, but I just have to say it clearly. I'm sorry, but I believe it's the truth, and then it has to be said. Because what happens when you strengthen? When strengthening, what often happens is that the tension, which is already too high, is drastically increased. Now it's increased even more to stabilize everything. People go from bad to worse. And that's why most soccer players stop at 30 or just over, because their bodies have become so shortened that it just doesn't work anymore. That's the only reason. And the one soccer player who came out, Pierre Mertesacker, who did our exercises for years, I put together a special program for him. I think he played until he was 35.
Quite a long time and very unusual because he's a very tall man.
Huge man.
For a soccer player.
I had to look up so high.
Very tall and still.
No, definitely. That's just totally messed up. They always focus on strengthening without thinking that strength is important, but it's at least just as important, if not more important, that there's relaxation and flexibility as well. So with the training that we now do here, which is really fully developed in the app in a positive way, and what I always teach the patients accordingly, especially those who come from high performance sports, that they don't just want to be bamboo. What is the advantage of bamboo, or what is the disadvantage of the oak? Let's start with that. If you train yourself to be like an oak, a storm comes, and if the storm is too strong, the oak breaks.
It breaks.
Of course, it can withstand a gentle breeze, but in high-performance sports, there are no gentle breezes, there are storms, because that's where real performance is required. And that's why all the time some muscle fibers or muscle fiber bundles tear. Then,
also tendons, yes.
Cruciate ligaments, Achilles tendons, and many other things can tear. Of course, because there's more and more force in the system, it just gets to a point where if the external force is greater, things tear. So we need flexibility, we need both, and that's why with our training we build bamboo oaks. The bamboo oak is the most valuable muscle a person can have, especially an athlete, and even more so a high-performance athlete. A muscle that is capable of, let me give a quick example. When skiing downhill or just skiing, let's not talk about competitions, let's just talk about regular skiing. You're skiing down a slope, enjoying yourself with your arms out to the sides, and suddenly you miss seeing a branch on the right or something else that's in the way. And you're just like, yeah, I'm happy in skiing down the slope, and then your right arm gets caught. Your arm gets yanked back and most people's shoulders dislocate. Why? Because ligaments are built there and the chest muscle gives way up to that point. The large chest muscle goes from here, now for those who can't see, from the inside of the upper arm, not far from the joint, all the way into the chest. So, and when that gets blocked, if the arm is pulled back, it puts real tension on the joint, a sideways pull, and then the shoulder dislocates. If this skier hasn't just trained for strength, but for strength and flexibility, then the arm simply gives way, comes forward again, and that's it. He won't get injured, and that's why in sports far fewer people get injured if they have bamboo oak muscles instead of just oak muscles. So not just trained for strength, but also trained for flexibility. And the best solution is to do that in a single exercise. And then even to push it further with external heavy forces, with weight training, with some kind of machine training and things like that, the flexibility has to be maintained. I have to say something now because my thoughts are just flowing. There's actually another effect, and that effect is when top athletes, I noticed it with the ski jumpers or the skiers, I noticed it with other athletes, if they don't stretch and have to withstand forces, then the body starts to build up connective tissue to help the muscles. And this connective tissue that is built up makes people stiff and unyielding. Because that's no longer the scissor lattice structure of the fascia, but it's firm and felt-like and no longer flexible, because the angles are simply not used to it. And then people have, the other day we already talked about this on the podcast, the feeling, oh, when I stretch now, where is my strength? I don't feel my strength anymore. And as we already said and talked about in the last podcast, my martial arts teacher, Sivoken Sprecht, told me before, how long ago was that? 30 years, 35 years, or even longer?
Longer.
Not longer.
Almost 40.
Almost 40. Yeah, that's right. He told me, Roland, the strength you feel, your opponent doesn't feel. In other words, the strength inside you, the one you feel, you can't transfer it to your opponent. And he put exactly what I explained earlier into a picture. With the swing, with the roll from the ceiling, where the counterforce is created. That means all the athletes, there is wonderful news. Not just for the athletes, not just for the high-performance athletes, also for regular people who just want to move well for a long time. Build yourself bamboo oak muscles because you'll have much more energy that way. All the energy that comes from resisting with muscles that don't give in works its way into the joints. That energy is no longer available for external movement, for athletic performance, or for the performance of life itself as life energy, because the law of conservation of energy applies. Energy can only be transformed. And when the energy coming from the muscles is converted into osteoarthritis and wear and tear, it is no longer available for external strength. That means I can lift less, throw less far, shoot less quickly, run less fast, and so on.
The magic word for us back then was really that these athletes who are so strengthened and have shortened muscles should stretch. But I still remember what that did to them. Stretching was so totally unsexy.
It was really unsexy, just for the girls.
It was so unsexy, and when they did stretch, they stretched for 5 seconds, and that was it.
You know, I still see that today.
There are two things. I think it still hasn't really sunk in how important proper stretching is, so please explain that again in a moment. So it's really important that these top athletes, but also everyone else, stretch and stretch properly. And not just for 5 seconds, because that doesn't help at all, but you'll explain it again later.
The proper stretching, as we call it.
How to do proper stretching.
Now we have to get back on track. Now let's relate all of this to older people. In the end, whether it's a young person doing sports, a middle-aged person, or an older person, it doesn't matter at all. The principles are always the same. We want to transfer most of the energy we can generate with our muscles to the outside. We want to be flexible. We want to be pain-free. We have our movement principles, our movement
profiles.
Profiles, that's what I wanted to say. Yes, we have them and they can be applied to everyone, of course, with special programs and slightly different exercises. Always in a way that meets the needs or expectations of the patient or the person affected in the best possible way. And maybe another topic related to this, which for young people, we've just been talking about top athletes, and so on, isn't really the main issue. Namely, muscle loss in old age. Muscle loss in old age practically makes it essential that we stay active throughout our entire lives, even into very old age. But the trap people are in now is exactly what we talked about at the beginning. They know I have to stay active. I'm now 50, 60, 70, 80, however old I am. And the more I move, the better it is. But they can't do it because they're in pain. And that's exactly where the problem comes in again, that they don't know how to deal with it. Then they end up taking painkillers, or they don't take painkillers, but they just sit at home and stay there, and so on. So all of this leads to a discrepancy, and they don't know what to do. But the solution is, and this applies to everyone again, to listen to your body. Where does it hurt? Because the body tells you exactly what's wrong with your movement pattern. How does it do that? It tells you through pain, and it even starts before that. It tells you through tension, it tells you through stiffness, but most people don't react to that. But with pain, it actually becomes clear. But since most people still don't know how to react, because it just hurts like hell and the solution isn't there. And they don't want an artificial joint. They also don't want any chemicals in their bodies, like painkillers and so on. They have a real problem. But now we come in with Liebschampracht and with our exercises, with our therapy. And what's next? Now comes a completely systematized approach where the body is divided into 12 pain areas. So there are 4 main areas: head, torso, arms and legs, and 12 further subdivisions. Head with neck and throat, jaw and eyes, or shoulder and wrist and elbow joint.
Elbow joint and wrist.
Yes, I know. And hip and knee and foot. Yes. So, and for each of these areas where pain arises, now it gets interesting. We don't care at all about what has been diagnosed there. 0, because it doesn't matter at all. It's only about the pain, and the pain is either non-specific. Let's just deal with that for now. What are non-specific pains? The ones that somehow aren't clarified in conventional medicine here. It's very simple. Non-specific pains are the pains that, as I explained, exist because of excessive tension. But since excessive tension can't be seen on X-rays, computed tomography scans, or MRIs, they're overlooked. They haven't been recognized in the usual conventional approach as much as is really necessary. Above all, that's because most pains actually arise due to excessive tension. We have pain, now it's in the shoulder, but it doesn't seem important. Is there calcium buildup like calcified shoulder? Is it an impingement, meaning this pinching? Is it a frozen shoulder, so a stiff shoulder? Is there osteoarthritis in the shoulder? With all due respect, it doesn't matter to us or to our approach, because the pain in the shoulder and the damage in the shoulder have a common cause, namely the excessive tension. Yeah, maybe I'm just thinking if it's getting to be too much, but I'll give an example of all these misunderstandings that are out there. With an impingement, I have the supraspinatus tendon here, a tendon that originates here inside the shoulder blade and then goes under the shoulder roof to the upper arm. And there's also a bursa there, and it's often inflamed, and then at some point this tendon gets worn out and so on. That's called impingement, pinching, where the tendon gets pinched between the head of the upper arm and the underside of the shoulder roof. There's not enough space there. So the mystery isn't solved. And what's the remedy that's often used? There's an operation for that, and the space under the shoulder roof is cleared out. Irregularities that have formed due to so much wear and so many changes are also removed. Surgery is performed, and everything is, so to speak, removed so that the gap becomes larger. I wonder, how can that be? What kind of reasoning is that? I mean, there can be cases where these protrusions stick out so far that you should remove them, but very, very often they're not that big at all. And how do I know that? Because I've had dozens, if not hundreds of people with such an impingement who were supposed to have surgery. What did we do then? We simply normalized the tension of the muscles and fascia so that this gap was no longer pulled so tightly together, but was looser. And then the problem was solved and it was gone. Because what actually makes this gap so tight? Yes, shoulder muscles that pull so strongly that the head is lifted higher and higher until it eventually gets stuck and rubs against the lower part of the shoulder roof, and the tendon is in between and doesn't feel comfortable. Yes? So that's just one example showing that these excessive tensions in the muscles and fascia are responsible for almost everything that causes pain and wear in the musculoskeletal system, which used to be called the locomotor system. And that's why we're now looking at where is the pain, because the question is, where is the pain in which location? Determines where we need to relax the muscles, either through our osteopressure.
That's the therapy method we've developed, that you've developed. The therapists then
72 points on the whole body, specifically on the bones, where you can very specifically influence our model into the brain. The brain reduces the tension, sends a different command to the muscles, and the whole thing normalizes the tension again.
relaxed.
Relaxed. And if you apply that, or do the exercises that do the same thing and the pain goes down, which is usually the case, then we know, once again, tension is the root cause here. That means if you're now the athlete, very pragmatically, who has 3 or 4 spots, where it sometimes hurts or hurts more, then you just do the appropriate exercises or simply have those areas treated by one of our therapists. There are thousands in Germany, Austria, Switzerland, and worldwide, but most are here with us. And then you'll notice in the first treatment whether it helps you. So we don't even need to get to the level of discussing it. Like, who's right now? Am I right with my assumption that the tension in the muscles and fascia is too high? Are you right? Is another doctor right who says, no, it's related to the damage, none of that matters? Don't listen to anyone. Don't listen to me. Don't listen to others. Just listen to your body. Not even to what's in your head, because maybe what's in your head is wrong. Listen to your body, and wait to see what your body tells you after the treatment. Or listen to your body and wait to see what your body says after doing the exercises. And if your body tells you, oh, my pain, which was at 100% before, is now reduced to 30%, 20%, 10%, or even gone, then you know what the right way is. And then you have proof that osteoarthritis, which happened to develop in parallel, osteoarthritis of the 2nd degree, has nothing to do with pain, because the osteoarthritis of the 2nd degree is still there after the exercise and after the treatment, but the pain is reduced. That's clear proof.
I would really like to talk again about the term you used earlier, sarcopenia. That affects people.
You still need to explain sarcopenia.
Yes, I'll get to that in a moment. This term, it's a disease, a diagnosis that affects people. It starts around the age of 45 and then it keeps increasing and increasing. Most people have never heard of it. And translated, sarcopenia means loss or wasting of flesh.
Often you don't even realize it's a disease.
But by now it's a diagnosis. Absolutely, well, but it's also obvious. Do you know how many people suffer from sarcopenia, or to put it even more simply, from muscle loss? Countless people.
If I stop eating and lose weight, that's not a disease either. It's just an effect of the fact that I'm not eating.
So if you eventually become really emaciated, there actually is a diagnosis for that. Are you always like that, or do you have cachexia?
But that's not what I mean. No, that's not what I mean. That's not what I mean. I just mean that there are effects of your life on your body. Yes, and when a muscle atrophies, it's usually, I would say, due to a lack of training.
Yes, exactly. But that's why let's please take a look at that, because I think everyone out there needs to know that they don't need to have that and shouldn't have it. Because with sarcopenia, that is muscle loss, a lot of things come along with it. Because when you have less muscle, you have less strength, you have a slower metabolism, and you have fewer opportunities to produce healthy anti-inflammatory substances, and so on and so forth. these myokines. And I think that's incredibly important. So for me, the question isn't even whether you should exercise or not. Because exercise causes pain, as we said at the beginning. No, it's very clear we all have to exercise if we want to age in a reasonably healthy and fit way. And that starts so early on, and we just need to understand what actually leads to pain. And I think it's really important to say again here that pain doesn't occur because the structure is damaged. That's not why they occur.
Not always, not always.
Really, I would almost say...
Yes, but only in rare individual cases.
Exactly, so that's not the reason why most pain occurs, but rather due to a lack of function.
Exactly.
So one of those, and that's exactly what we need to balance out. I remember you said once, actually probably more than once, you say it quite often, if you look at how much mobility humans have and how much of it we actually use, that number shocks me every time.
For the shoulder, it's under 5%.
Yes, and I want you to say it again, we do way too much, always just the same movements. That means we do too little of all these movements that a shoulder can actually do, like reaching back or whatever.
Exactly. I was just about to say you can explain it even more precisely by saying we don't use many angles that are actually intended.
Yes, yes.
We don't use them and always only use one side, not the other. That's why one side gets shortened. And we've already gone through all of this and explained everything. But this sarcopenia really shocks me now that it's considered a disease, because I would say this disease is actually very easy to get rid of by doing our exercises and possibly adding strength training.
Yes, and then also eating properly, yes, and eating right.
Maybe we should do the following now. Maybe we should explain, because we've been talking about our exercises the whole time, maybe we should explain what's actually in them, so that people can understand why, in the shortest amount of time available, you can achieve the most positive effects. Because the problem is, yes, that's the problem. We said earlier, you can't do different sports anyway. Yeah, or is it important? Then you go first.
No, I can keep it to myself.
You can't do it anyway because the schedule is just too full, right? But now it's about making sure that even a little time is used so that as much as possible happens. And now we have exercises that include stretching in the form of a passive stretch. What is too short has to get used to becoming long again. Then we have strength training included, maximum strength training, and it's really, really exciting. In the most stretched position, in the longest position of the muscle, it is taught to generate strength. And that's extremely valuable, because the effect is that with these shortenings where the muscles are stretched to a length they're no longer used to, there's no more strength there either. That alone is already a loss of strength throughout the whole body. Keyword, sarcopenia. Yes, the muscle has to learn again to generate strength along its entire possible length. And we do that with maximum activation, with maximum tension, and that's already strength training, which is included in every exercise. This leads to the muscle's strength and ability to perform, to do work, to move, lift, push, or do anything else with the muscle. That it increases, and the body learns this, because what most people don't know is that the body or a muscle, when you put it under stress for the first time, it might only be able to use 50% of its fibers. Then you do it and repeat it, and then from 50 it becomes 70%, then 80, then 90, and eventually, and maybe we won't quite reach 100, but you can almost double it from 50 to 90 just by repeating it over and over again. Then there's a third phase in this exercise, and in this third phase we also do strength training, but fast. Now the muscle learns to tense quickly, almost explosively, in order to relax just as quickly, and each time it gets stretched a bit further. And what happens with this quick tensing and relaxing? You just mentioned it, metabolism. Blood pump, because the veins have venous valves, and when pressure is applied to the muscle, tensing puts that pressure on the vessels. Because the muscle tenses, the vessels get pressure, and the venous valves force a flow direction. There's a real blood pumping effect. These are basically built-in pumps, but they only work when we move. Now just imagine as a listener, if we move very little, Think about how much metabolism is lost. That's something we already know. After 30 minutes of sitting, metabolism drops nearly 50%, or there are some numbers in that range. In any case, what happens there is drastic. So that's the third phase, and then comes the fourth phase. And in the fourth phase, you now take the muscle on one side of the joint and stretch it apart using the muscle strength on the other side. And now it gets really exciting because this trains the muscles to communicate with each other. So on the front and back, or on the inside or outside of the joint, the muscles will become active. Controlled by the brain, they communicate with each other and decide, aha, you're pulling, how much are you giving in? I can't give in. Should I pull less or pull more, or do I have to give in more? All this communication, which ensures that the joint moves correctly according to its geometry, that is, without wear, is decided and trained in this way. And at the same time, we assume that with this active stretching, the new programs for this new length are programmed into the brain, meaning new synapses, new connections, and so on. The program is ramped up, the quality keeps improving. Let's put it that way. Yes, the quality of the programs keeps getting better the more we do it and the more precisely we target it. And all these four things are included in one exercise in 2 minutes. And I think, I'll just boldly claim it, there isn't an exercise that does more in 2 minutes than this one, right? At least I don't know of any.
That's what I wanted to say earlier when you said, let me finish. I just wanted to say, the fascinating thing about our exercises and this system is that in a very short time, you can work incredibly effectively. Because, you can actually balance things out by doing just as much in the other direction with certain movements. That's not possible at all. We can't do that. But exercises designed like that, which cover everything you just explained in such a short amount of time, I think it's just fantastic that this exists, and we should definitely work with it, because we will improve so much in our bodies through it, which increases the quality of our vitality, our life, and our joy. That it would be fatal if we didn't have it.
The very best thing is, I warmly invite you as listeners, because what we're talking about here is already a bit shocking. Maybe a bit surprising for many, because they don't know that these possibilities exist, and maybe they don't really believe that it actually works. But the great thing is, I have now called for a life experiment for a lot of people, and this life experiment consists of proving that the older we get, the more pain-free, flexible, healthier, and stronger we can become. If we do certain exercises, namely the exercises I just explained. And this takes place in the app. There's a large group training together with a big community. And in the end, they all prove it for themselves with their own bodies. Because I said earlier, don't believe me, don't believe Petra, don't believe anyone else. Just believe your own body and what happens to it. And there's no other way. We have to try it. I know I've been aware of this development for 40 years now. I observe it in myself. I myself am also on this path, training my body more and more in this direction, and that will have effects, more and more. You might know a 1-minute print or this.
The 1% method?
You've probably read the 1% method. If not, then do it. It's worth it. You can achieve a lot over the medium term with small stimuli and small training improvements. Over long periods of time, it becomes so exponential that I'm curious to see where we'll end up. And anyone can try this in their own life. That's why I called it a life experiment, because of course we can live by just thinking, what do people generally say? Oh, there's sarcopenia, nothing I can do about it. Yes, maybe someday there will be a medication for sarcopenia, but even modern medicine, let me just say, everyone agrees on this. Every study shows that basically physical activity, moving, building strength, and training are the best medicine there is. That's how far regular medicine has come by now. But actually putting that into practice in your own daily life, what should you train? What should you really do to make the most of it for yourself? Usually it doesn't go beyond that. Well, take a little walk, go for a jog, just do some sports. Yeah, but what exactly? It hurts for me. And everyone, or many people, are stuck in this trap that the older they get, the less they're able to actually follow all the good advice. Because they can't go for walks anymore since their knee hurts after 100 meters or their back gives out. And all of that is reversible, and that's what we prove in this. I warmly invite you to just give it a try. You can cancel it every day because it does cost something, since it's a lot of work to do all of this.
Exactly. Are we done?
Yes.
Yes, I think we're done for today.
I can imagine there are a lot of questions about that. Please just ask them. I hope someone can answer them. Then yes, we'll definitely do that.
Sure, there are answers, and besides, maybe there will be a live podcast soon. I could imagine that too, that you can ask questions, and we'll be there. And about the topics that define us, and that might interest you as well. Yes, for today, thank you for listening. I find it super exciting. So, pain is not an enemy. Pain helps you. Sports are a must. Definitely remember that your muscles also need to become strong so that you stay strong. By the way, that's why it's incredibly important for your mind. We keep forgetting that. And all those age-related dementias that exist, taking preventive action against them is also part of today's topic. And otherwise, feel free to write anything you want in the comments below. And you can also leave a rating.
You should definitely leave her a rating on Spotify or Apple. Yeah, bye.
Bye-bye.